welcome to the Keys to Therapy. In today's episode, I'm going to be continuing my series called Working in and then whatever setting. So today's episode is going to be about working in community mental health. So community mental health gets kind of a bad rap. Like there's a lot of negative stuff out there about it. And a lot of times people either try to avoid working in those settings or really don't spend a lot of time there. So I think that's the part that usually gets highlighted more so than anything else, but you could get a lot of experience being in that type of facility. So since I worked there, and like I mentioned in a previous video, I'm only going to speak on the places that I have worked. I want to be able to share my firsthand experience with working in community mental health. So obviously it's going to depend a lot on the setting, the city, the funding. Like there's a lot of different pieces that are going to be impacted. So this isn't a one size fits all, but I think sometimes it can help give you an idea of what this type of setting can look like, so you can make a bit of a more informed decision and possibly even know which questions to ask or things to look out for if you are considering working in this type of facility. So community mental health is typically a facility that provides services at no cost or low cost to the community that it's in. So when I worked community mental health, it was my first job after graduating with my master's in social work. I just got my provisional license paperwork. So I had, at that point, it was like a PLCSW, and now it's an LCSWA in North Carolina. So basically an associate license. And I needed to start my hours. So I found a job at community mental health. And like I said, it's a facility that it typically a lot of the people that go there don't have insurance, or they might have like Medicaid or Medicare. And you work a lot with social services. You work a lot with like community service boards and case managers who are responsible for helping people who might be on like disability or might have some sort of issue going on where they're receiving like state or federal funding to help them out. So it's not a bougie place to work. It's a lot of different types of people that come through there, and I think that overall it could be a really great learning experience. So most cities have some kind of place like this. Obviously the bigger the city, the bigger the facility is going to be. And most times with community mental health, there's going to be a lot of different resources in one building. So you might see substance abuse, you might see case management, you might see mobile crisis, you might see detox, you might see therapy for kids, therapy for adults, groups, like lots of different stuff, because usually this one facility is providing or needs to provide like a range of services for the community. So I know in the place I worked, they had every single thing I just listed. They had like a little inpatient detox unit. They had aftercare groups for substance abuse. It was originally primarily a substance abuse facility, but they combined with a mental health practice and then started to offer both services a little bit before I started working there. So I was hired on the mental health side. There was a couple different like associates that had more of a like mental health therapy background, but they did some of the groups on the substance abuse side, and then they pursued substance abuse licensure too. So I think one thing that is really helpful is if you aren't really sure what type of population that you want to work with, or maybe you just have like varied interests and you're like, well, let me kind of feel out what I really do like, what I don't, and let me get as much experience as possible. This is the type of setting to do that. You will grow so much in community mental health because you are going to be exposed to a lot of different people and situations and resources and everything else that you can really then decide more of what you do and don't like working with, or what type of specialty training you might pursue more in the future. And you can really start to like hone in on where your career is going to go next when you work at a place like this. Now, because you're seeing all different kinds of people in all different kinds of settings, and like I said, it's different, whether it's substance abuse, it's mental health, it's severe mental health sometimes, and foster care, and there's like so many different things. It's a very heavy job. So I know as a therapist working in a facility like that, I had only ever really worked with adults. I'd never worked with anybody younger than 18 prior to working there. And suddenly I was working with as young as 4. And probably not the best because there's no real training. Everything's like on the job training. So you're given, other therapists that worked there gave me some different resources that they hadn't used. People were really collaborative, which was very nice because I was just out of school. So people would, share resources, coloring books, toys. Sometimes people would buy, that works there because you're buying almost all your own supplies. So you're buying some new stuff and then they'd give you their old stuff, or, things that they've noticed like none of their clients really use anymore, or they've got doubles of or whatever. Like people would share, which was really nice. So I would work with kids as young as 4, which I quickly found I did not like working with children. And it wasn't the kids at all. It just wasn't my comfort level. I just didn't really relate to that population. And I never really had much of an interest in working with young kids, but I had friends who that's all they wanted to work with. They didn't want to work with adults. So it's good to keep that type of stuff in mind of, I thought that, but then once I started working with that population, I was like, well, it's a good growing experience. But at the same time, it's just not something that I want to pursue. I'm not going to go forward with like being trained in play therapy or anything like that. So same with substance abuse. I was doing some groups that dealt with like teenage substance abuse. So 3 days a week, intensive outpatient. I would be helping co-host maybe like 1 or 2 of the days. It was like a Monday, Wednesday, Friday group, like co-facilitating the group. So love the teenagers, but really didn't love the substance abuse element. And I also worked on the detox side, and I did a partial hospitalization group. Eventually that became my thing I did for half the day. So they needed a licensed or provisionally licensed person to go over there to help. So what happened is in the detox unit, people would come in and stay for detox. And if they had co-occurring disorder, meaning they had mental health and substance abuse issues, there really wasn't any resources there for them. So what the facility did was create a partial hospitalization program, which meant partial hospitalization means that you do groups and everything you would do at the hospital all day, but you get to go home at the end of the day. And so for the people who were in detox, they were able to come to my group throughout the day and then go back in the evening for AA or NA or some of the other like very substance abuse oriented type treatment and groups on that side of things. So that was great experience for me because I had done process groups at the hospital I'd been at before, but that I had never done a structured group. So I was able to work with somebody on building a lesson plan. And every morning I would go in and we would do a bit of like processing and then some kind of like psychoeducational component. And then it would be time for lunch. And then at lunch, I would go back over to my office and I would see individual therapy clients from 12 to 6 with like a lunch break somewhere in there. And so it was a lot. It was a lot of work. It was a lot of notes. But I really loved being able to switch up my day. So doing group stuff and learning more about different people. The group, a lot of the people would stay in, like those who came from the community or those who left detox even and enjoyed the group would enroll in it. So they would be in it for, I can't remember if it was like 8 weeks or 10 weeks, something like that. And so they would come to the group on an outpatient basis, which was really cool because then you got to follow up with them. And then some of them wanted individual therapy. So then I would just see them individually. So it really worked well for me to be able to see people at these different stages and kind of walk down in levels of treatment with them. So to see them in the inpatient detox side and then to know that they had the substance abuse resources set up for them to help on that end. But then I could help them on the mental health side of things in the group and then eventually individually. So it was like a step down process. And a lot of times with mental health, you don't get to see people through all of those stages, but in community mental health, because you're doing everything, you get to. So the nice thing about being there too is it was a regular facility, right? So you are only there for 8 to 5, 8 to 4, whatever it was. I happened to be there. The way our schedule worked was we would work till 6 Monday through Thursday, but we'd have half day Fridays because we'd work that extra hour throughout the week. Loved it. Yeah, it sucked sometimes staying till 6, but at Friday at noon when I was out, obsessed. I really liked that. So it wasn't a very flexible job, but I did like that there was that ability, that component there. To be able to do that and have those half day Fridays made all of the difference mentally, because it was really tough work. So Fridays I would just go in and do my group and then go home. So I really liked that. I worked with, like I said, a lot of different disciplines. So there was a psychiatrist, there was a lot of people trained in substance abuse. I did all of my supervision there with my supervisor, so that was included in my salary. So even though my salary was pretty low to start out, and it was like a little, it wasn't like a city, it was like 30 minutes outside of Charlotte, in North Carolina. And so it's one of the downsides of being in community mental health is there's usually not a lot of funding, because again, a lot of the people coming in, they're not paying for services, or if they are, it's like very, very minimal amounts. I remember at one period of time they said that we had to start collecting copays, or the front desk was going to start collecting copays, and it was kind of a pay what you can. So people would pay $1, $2 for their therapy session. So that meant that there wasn't a ton of funding left for the salaries for people. So they offered me 35 and I negotiated to 36.5. But I had insurance, I had paid time off, but I would get like 2 hours every 2 weeks. So it would take forever to accumulate time off, but having those half day Fridays helped, because then, I would just, if I was taking a vacation or something, leave after work, or if I had to miss a Friday, it wasn't a whole like 8-hour day. So again, not great, but just starting out, I made it work. It was fine. And then I had supervision included. So even though my pay was low, my supervision being included, which in North Carolina, you have to meet with your supervisor like 1 hour for every 40 that you were working. So once a week. And so we had that set up. And then once a month we would do group supervision, and somebody else would come in from out of town, and then me, and then whoever else was being supervised in the same facility. We would all meet as a group. So that was great. But there was lots of different, like I said, departments and resources and people to help out. There was a front desk person. There was an insurance person to ask questions to. We shared, there was another side of the building that I don't think I ever even went to, because they didn't have to, but there was like case managers and mobile crisis and stuff over there. So yeah, it was a lot of resources. So I got to learn about a lot of things that were available in the community. And like I said, it was a great experience. I learned a lot about the foster care system. I learned a lot about social services. I had quite a few kids who were in group homes or who were in foster homes. So I would have to coordinate with social services to do like meetings. I think it was like quarterly for some of them. And then we would have like treatment team meetings I'd have to be a part of. And, you're just kind of learning all the ins and outs of the system, because now you are one of the people within that client's system of care. So it's, again, heavy work though. So on the plus side, like I said, it's a great experience. You learn about a lot of resources. You have a big team, so there's almost always somebody available to answer a question. A lot of times in like private practices or places like that, everyone's in their office all day long. And they're in sessions. You don't get to stop and talk to somebody, but at a facility like this where there was a lot of different employees, someone's door was almost always open if I really had a situation that I needed some help with, or needed to process something, or just kind of needed somebody else's perspective. Or even if it was something like, hey, do you have Uno cards? Like, I've got a kid coming in this afternoon and, somebody else is borrowing my pack, or I need to get a new one, or whatever it was, and people would share. So that was really nice. Another thing that was great about working there is that we would have, they'd call them like lunch and learns. So once a month a speaker would come in and they would provide us with some kind of lunch thing, sandwiches or whatever, and they would talk to us about whatever that thing was. So whether it's a new resource in the community, whether it was a new protocol for domestic violence, whether it was like, I remember when the DSM changed from 4 to 5 or 4TR to 5 or whatever, we did training on that. So lots of opportunities for trainings and stuff that were free on site, which was great. And sometimes the facility would get funding to send the employees to trainings. So I was sent my first year to a training in Asheville. So I felt so fancy. They were like, here's your hotel, and we paid for this training for you. And I think I even got reimbursed with the mileage maybe for like the 2-hour drive. So yeah, that ended up being cool. Me and a couple other people got sent to Asheville the weekend of Halloween and learned about that substance abuse group that I was telling you guys about with the teens. So kind of got all of the training on how to run those groups and the book and all of that stuff. So that was great. That was really cool. And then the second year that I worked there, my friend and I were sent to the statewide conference, which was also in the mountains, but further out, and at this lake, and it was really pretty. And they put us up in a cabin. So she and I had our own rooms in this cabin, and there was like a little creek in the back. Like, it was really cute. So, you know, that was nice too. We got paid to go to the trainings. The trainings were paid for, and then we got gas mileage. So it was a great experience to get to network with some people. So that was a bonus that I'd never had at any job that I'd been at, and I honestly haven't really had since. So, you know, there are some bonuses. Obviously, not every place is going to have the funding every year or at all, or the resources might be limited, but I found, at least at the place I was at, they really did try to give it back to the staff, which was nice. Now the cons, well, backtrack. Another pro was, like I said, supervision was included, and at a lot of those types of facilities it is. Now you have to make sure you like your supervisor and get along with them, and they are a good fit for you, because that's the only way that it's really worth it. Because I know supervision can be expensive if you're paying for all of it on your own. So to me, that added like thousands to my salary, because I didn't have to pay $100 a week, right? So $400 a month, when I was really only making $2,000 a month. Every 2 weeks, I made $1,000. So not a lot of money. And luckily, at that point being 23, 24, living on my own and not having a ton of bills. So obviously all the student loan debt kicked in, but like not having a lot of expenses, I made that work. Lots of peanut butter sandwiches. But I think that, you know, that's something to consider too. So it goes back to the cons, like I was going to start off with, is the pay. Even though supervision's included and that's huge, the pay tends to be very low. And there's not a lot of opportunity for raises. I think I did get a raise the next year I worked there. But it wasn't very much, maybe another $1,000 a year, which when you break that down into 12 months, you know, 24 checks or whatever, it ends up being like, it really wasn't that much. So I don't think there was much of a bump on paid time off either. So there's not a lot of opportunity to grow financially unless you possibly like switched positions there. But from what I saw and heard, a lot of the people in more of like an administrative role, they were under a lot of stress. You're stretching funding. You're trying to make sure you can keep all of the staff that you have and be able to pay everybody and provide training and resources and occasionally supplies and stuff like that when possible, marketing, whatever else, with really limited resources. So I remember there being talks pretty frequently about us needing to see a certain amount of clients every week to prove that we should be there and that we were earning our salary. So it got to the point that like every week we would have to print out our schedule of how many people showed, how many didn't, and like write that number down and attach it to our notes. And then whoever was responsible for all of the filing and stuff would be keeping track of that and pass that information to our supervisor, who would then have to answer to the higher up people within the company to be like, well, she brought in this much money last week. She saw this many people in the group. Medicaid paid us this much. She saw this many people individually got paid this much. So she's earning at least her salary at this point. So that was a little scary sometimes, feeling like at any point they could say, sorry, we just don't have the money for your position, and always feeling like you needed to keep seeing clients. And in that setting where people aren't paying for sessions, there's a lot of no-shows because there's no real consequences. If somebody has Medicaid, you're not allowed to charge them a no-show fee. You're just not. So with a facility like that, that's primarily taking something like Medicaid, you can't charge those fees. So a lot of people, because again, there's no consequences, they just wouldn't show up. So on the clinician side, because I got paid a salary, it didn't affect me as far as my pay went. But numbers wise, if a bunch of people don't show up, now it looks like you're costing the company more than you're making them. So just kind of keeping some of those weird dynamics, like asking those types of questions, right? Like, how's the funding for my position? Is that secure? Are there a lot of staff changes here? Are there any concerns regarding, financial status of this facility? Like, there's a lot of stuff that you might want to know, and some of that you might not know till you're in it, and then ask those questions. I know sometimes in the beginning you just need a job, so you're going to do what you got to do and figure it out, but you want to make sure that you're like paying attention to these types of things as you work in these facilities, so you aren't blindsided later. Documentation is insane. It's so much in those types of places too, because Medicaid has very strict requirements for what's required, like in your notes. So they've got this huge list, and you needed to have all these different sections filled out thoroughly in order to meet the criteria and get paid. So the notes were very extensive. And when you do a group, it's cool because you get to, kind of help all these clients at the same time. But then you also got to sit there and do a note for every single client for that group. So I would have to sometimes either come in early, or I really advocated to get my first hour of the day, or first half hour, whatever, of the day before I started my group, to not see any clients. I had to fight for that, because I was like, if I'm in this group all day and then I come back and I see a client and then I have a lunch break and then I'm seeing 2, 3, 4, 5, like 4 more clients in the afternoon, when am I supposed to do my super extensive notes for them? And when am I supposed to do group notes for 10 to 15 people? So, luckily I had a great supervisor, and so she understood that. So she made sure I had that time blocked off in my schedule. But yeah, you have to advocate for yourself a lot in community mental health sometimes, because it becomes a numbers game. It becomes a money game. So you need to make sure that you're good. And again, that's not always, just because you advocate doesn't mean that you're going to get what you want, but at least you can practice speaking up for yourself and trying to get what you want, and that may make your decision whether you stay or not. But I know a lot of people tend to stay throughout the licensure process, and then once they get their license, they get a pay bump, and that may be enough to keep them there. They may really like the job. They may move up in more of an admin position, or sometimes, a lot of the times, people get their license and they leave those types of facilities for a different job because they're burned out, or they don't want to work with everybody and anybody. They want to specialize in something. So, again, there's lots of pros and cons to working in community mental health. I would not have changed my experience. I'm really glad that that's what I did right out of school, because I think it was nice to have that much support, to have supervision paid for, and built into my workday already. I wasn't having to find somebody who could see me after work hours or on my lunch or something like that. I liked having so many different coworkers that could really help me out if I needed it. And obviously not everybody was like that. That's another episode. But a lot of the people were. So it was great to have an entire team of people. So if you did have a really hard session, you could take a minute and go talk to somebody. You have a cancellation and you see that your friend down the hall does. Go hang out with them for a little bit and just kind of process everything that you've been dealing with. So for a lot of people, it's your first big job in the career, and there's a lot coming at you. So you'll need that. But yeah, so that's it for community mental health. I know it's kind of a lot and it's sort of all over the place, but I want everybody watching to be able to get the real experience, the real deal on what goes on in those types of places. And like I said earlier, the city you're in, the state you're in, the people in the facility, how much they're advocating for the facility, there's so many factors that can really change your experience there. But I think you have to look at all those things. And like I said, maybe some of the things I mentioned today as far as pay and expectations and stuff like that will be questions you ask if you're interviewing at a place like this. So if you want to stay on top of future episodes, go ahead and subscribe below, and then you could see what's coming next in the series. But other than that, I hope that I see you all next time, and have a great week. Bye.